Yeah, what is allergic rhinitis? The term rhinitis comes from Greek, where rhin means nose and itis refers to inflammation. So rhinitis simply means inflammation of the nose. When this inflammation is triggered by allergens, it's called allergic rhinitis. Allergens are harmless substances like pollen or dust that, when inhaled, can provoke an exaggerated immune response in some individuals. When allergens enter the nasal passages, they interact with the immune system. Specifically, they bind to IgE antibodies attached to mast cells. In healthy individuals, this interaction causes little to no reaction. However, in people with allergic rhinitis, the mast cells overreact, releasing a chemical called histamine. Histamine sets off a chain reaction. It causes inflammation and swelling of the nasal lining. It triggers excessive mucus production, leading to nasal drip. This mucus buildup blocks important drainage pathways. The nasolacrimal duct normally drains tears from the eyes into the nose. When blocked, it leads to watery eyes. The eustachian tube helps drain fluids from the middle ear. Its blockage causes a feeling of stuffed ears. Additionally, nerve endings in the nasal cavity become irritated, leading to sneezing. Together, these effects cause difficulty in breathing through the nose. Allergic rhinitis typically presents with a range of symptoms. These include nasal congestion and swelling, watery eyes, a feeling of stuffed ears, nasal drip, frequent sneezing, and trouble breathing through the nose. How is allergic rhinitis diagnosed? Well, diagnosis is usually based on a combination of history and testing. When it comes to patient history, symptoms like sneezing, congestion, watery eyes, and the timing of these symptoms, particularly if they are seasonal, strongly suggest allergic rhinitis. One common test is the skin prick test. Here, tiny amounts of suspected allergens are introduced to the skin. If the skin reacts with redness or swelling, it confirms an allergy. Blood tests can also be useful. For instance, an elevated total eosinophil count supports an allergy diagnosis. Higher levels of total serum IgE are often seen in allergic individuals, and this can be measured through the RAST or radioallergosorbent test. Another method is a nasal smear, where a sample is taken from the nasal lining to check for inflammatory cells, further supporting the diagnosis. When it comes to treatment options for allergic rhinitis, effective treatment aims at different stages of the allergic response. Avoiding allergens is key, so preventing exposure as much as possible is crucial. For example, wearing masks during pollen seasons can help. Reducing inflammation is another critical step. Nasal corticosteroids help lower inflammation directly at the site. Using antihistamines can block histamine receptors, preventing symptoms like sneezing and a runny nose. Mast cell stabilizers are another option. These drugs prevent mast cells from releasing histamine by blocking calcium channels involved in cell activation. And finally, there's immunotherapy. Allergy shots gradually expose the immune system to allergens, training it to react less severely over time.